I found this quote kind of surprisingly from Vincent van Gogh. And if you know anything um, or if you like art, this Vincent van Gogh is an artist that lived several hundred years ago. But it's really interesting when I was going through some quotes that I thought would be, interesting to share with you, that he quoted, your profession is not what brings you home your paycheck. Your profession is what you were put on earth to do with such a passion and such intensity that it becomes a spiritual calling. And if you Google Vincent van Gogh, he really had a very turbulent life, but he was so inspired and he was such a passionate uh, uh, artist that he was also looked down upon a lot. But at the same time, he felt very compelled to continue to create art. And um, you've seen his work before. It's in a lot of the merchandise, sometimes of the lilies and of the Starry Night. But what he said about um, passion and working, not just because it brings home a paycheck, but because you are compelled to work and live out that passion. And I wanted to share that with you because nursing to me is and has always been a passion for me. And it wasn't about the money. It wasn't about you know, uh, bringing home as much dollars as I can. It was never anything about that. It was wanting to be there for patients and take care of them and be patient advocates. And so I think this is one of the reasons why it that quote really touched me. And so again, Google Vincent van Gogh. He really is one of my favorite artists. And I see that Patricia, he's one of your favorite artists as well. He has very vibrant colors. And, I love his work. Um, Anyways, I just wanted to thank you for being here today. Just a couple more announcements. In regards to your midterm exam, I was really pleased with the scores that came out of it. The average score was 4%. The highest score was 98 and the lowest score was 2%. It took an average of maybe 50 minutes for people to complete both the midterm and the bonus midterm questions. So, I think that going through the midterm review may have helped a lot of you, which I hope it did. The other thing I wanted to remind you again is that there is a case study that is going to be due on March 11th. The next time we meet, I will go over the case study so that way it's a little more clear of what I'm looking for in your responses. So you may want to hold off for completing that case study number 2 for now. But if you are comfortable, please go ahead and respond to it and submit your work. Okay. Now, I am really excited to introduce to you Deborah Taylor. Deborah Taylor is not only a friend, but also a colleague at De Anza College, and she is truly an advocate for nursing. Um, she is the one that knows everything and anything about the nursing program. And that's why I invite her here because she is just a huge um, knowledge of the nursing program. In fact, she is the one that really looks at your nursing application. So I hope that you have some questions for Deborah. But in the meantime, I will turn this over to Deborah. Thank you so much for being here, Deborah. I really, truly appreciate it like I do every quarter and every year. You are my hero. You are absolutely my hero.
Right.
But I will now hand it over to you, and I think you have the ability to share your presentation with the students.
All righty. Thank you. Good morning. Good morning to all of you. I'm happy to see you here. And there are 3 pages of tiles. That excites me um, because that means that we have that many people who are interested in nursing. And then you're here in class. So you're completing your prerequisite. That's also exciting. Um, some of you I probably have spoken with, and others I might not have spoken with, but I am the screening and selection coordinator. I am the person who reviews your application to determine whether or not you're qualified. So that's why I appreciate your instructor inviting me to class because I'm a proponent of when someone walks alongside you and you know what to expect, then you can do your best and be prepared. It shouldn't be a mystery about what's required to enter the program. So I do a lot of so-called hand holding with students because I want to see you be successful. I had a lot of people to do the same with me. So this is my way of paying it forward. And then one of my favorite days on campus is that I'm meeting you now while you're in the Nursing 50 class. I probably will see you again along the way as you complete your prerequisites and submit your application to enter the nursing program. One of my favorite days is orientation day when you actually enter the nursing program, because then that's the start of your journey. I guess I could say the second leg of it, because the first leg is you preparing um, and completing the prerequisite classes. But the ultimate joy is on graduation day when we have the nurse pinning ceremony. And I'm with you on the stage. I might be able to pin you, put the sash on you, and to see you go on your way and start working in the healthcare industry. So that's my motivation for being here today. I too am a nurse. I'm a licensed vocational nurse. I've done a lot of unusual nursing jobs. I've been the utilization review nurse at Children's Hospital Oakland. When it was that, now it's UCSF Benioff Hospital. At that facility, I was introduced to the world of research. And so I worked alongside some hematology, oncology doctors, um, hematology, oncology, blood disorders, and cancer. And they were conducting research on patients with sickle cell disease, which in your anatomy physiology class, you may learn about that um, a lot later. But I have assisted them with some of the research. Um, Next month, I'll participate in some healthcare legislation days. We call it Hill Day. And so we will be on Capitol Hill virtually this year in Washington, D.C., to speak with some of the congressmen and senators about healthcare legislation for patients with sickle cell, to put some protections in place for people with chronic illness and access to care, things of that nature. So I didn't know when I was in nursing school that I would be able to work um, with regards to healthcare policy. So another avenue of the nursing career that we hope to introduce you all to as well. Before I get started with talking about the nursing program, I did email your instructor a flyer. Also next month coming up, and I think I'm gonna pull it up. Maybe I can pull it up real quick. I got a lot of windows open here. Um, One of our other colleagues who was a nursing instructor, her name was Sandra Diaz. And so she taught in our nursing program, and we lost her in, I'm trying to remember the year. It was during COVID, and we lost her to COVID. And so since she's passed away, we have a health careers roundtable or health careers panel in her honor. So Tuesday of next week, March 4th, from 12:15 to 3 o'clock, we're going to be hybrid. Some people whomever can attend in person, we like to welcome you to come in person. And if you're not able to be with us in person, you're able to join via Zoom. And so we'd like for you to register on the nursing webpage so that we can make sure you get all the documents and everything that's given to the folks who are in person. But what we're going to do that day is, you see here, we have a list of the speakers. And so we have nurses from different areas of the nursing field. And we also have 3 women who are studying to become a registered nurse anesthetist. And that's kind of a new thing in the area of nursing. They're also going to speak to us about a new degree that they're pursuing, a DNP. Some of the universities no longer have their master's degree in nursing, the MSN. They've eliminated that. And now they're moving in the direction of DNP, which allows nurses to be more competitive. So on that day, they're going to speak about all those things. We'll have time for questions and answers. If you come in person, there, of course, will be some snacks. And then we're going to have a memorial ceremony to honor Sandra. And then after that, we'll have a hands-on activity demonstration. Some of those same nurses from the career panel will come into the nursing skills lab on campus, and they're going to do a clinical demonstration for us. And they're going to demonstrate how to intubate a patient. During COVID, people were very sick and they ended up on ventilators. And so part of that ventilation process is having a tube put down your throat. And so they're going to demonstrate how to do that with care and success for the patient. So we hope that you're able to join us either virtually or in person. So some of the other things that I do when I'm not reviewing applications and holding court with students, so to speak. Okay, so I'm going to get started with the presentation. I want to put up some information first. Maybe. Okay. So if you haven't been in contact with me before, here's my contact information. That's my name, Deborah K. Taylor. I'm the screening and selection coordinator for De Anza College nursing program. You can reach me via email or via phone. If you're contacting me via email and you want to set up an appointment, when you're emailing me, just say what your availability is. I'm available Tuesday, Thursday between 9 and 12, that kind of thing. And that way I can schedule your appointment during the appropriate time frame. If you're working and you want to set up an appointment, we can do that via Zoom. You don't have to come in person. And if you have to do it during your lunch break, I can be available during that time. I just adjust my time of the day to accommodate you, and we can meet via Zoom to walk through prerequisites to see if you're staying on track. If you're at the end of the journey and you're ready to prepare to submit an application, I do an application review appointment where you do a rough draft of the application. We go over it and review it to make sure everything is in order. I go into your student portal. There's a section in there called DegreeWorks where all of your coursework is documented. And we make sure that you've completed all the prerequisites and your grades are sufficient. Everything is in order. If you've taken that HESI exam, we look at your scores, and then we play around with that other criteria for admission, the chancellor's formula. We do all those things during the application review appointment. So by the end of that appointment, you pretty much know where you stand when you submit your application. Okay, so sometimes you meet with me If there are other situations that arise, say, for instance, if you have some coursework from another college and you might need to go through the petition process for whatever reason, then I hand you off to our counselor in the nursing program. So Tom Wynn is the counselor that's dedicated to the nursing program. And so he and I tag team one another to assist you with your application to the nursing program. Okay, so I have Tom's email up. If you want to use the search engine on the college website, you can type in his name. I believe he has a page, and he might do virtual appointments on certain days of the week. I don't, off the top of my head, remember what those days are. But I wanted you to have this information at the end of this presentation. I always email the slides to the instructor, and you can obtain all the slides that I used today from your instructor so that you'll have that information with you as you go along your journey. And remember that I'm available to you to answer questions and all that good stuff. Let's see. Okay. Let's start here. All righty. So the nursing program has a website on the college website. So if you're on the De Anza College webpage, in the search engine, if you type in nursing, then our information is going to come up. The same information that I'm speaking to you about this morning is also on that website. In addition to the application for the nursing program, a template for the chancellor's formula, and other information about the HESI exam, the wait list for our program. All of those things are on that nursing website, in addition to the flyer that I just showed you for the upcoming event. So do make yourself acquainted with that page. In addition to all the other things that I mentioned, it has the application periods listed. So at De Anza, of course, we're on a quarter system, different from many of the other community colleges who are on semester systems. And so for those colleges that are on semester systems, they may only accept applications once per year. At De Anza, we have 3 application periods, and those application periods overlap the different quarters. So we begin in September, and the first application period is September 1st through September 15th. And then we have another application period beginning November 15th through January 15th. And we're in the third application period right now. It began February 15th and it will end on April 15th. During the summer months, we don't accept any applications because we take a break. The nursing program is very intense, so we allow the students to have a break, enjoy their families during the summer months because when the program is in session, it's very intense. It's a full-time program, Monday through Friday, 2 consecutive days of the week. Students go to the clinical site, which means you're going to show up at the hospital to do your clinical training. And the other days of the week, you're either in the skills lab or you're taking classes with other instructors. So the application periods are listed on the website, testing deadlines. If you're taking the HESI exam, I'll use the example of our application period ending April 15th. You want to make certain that you take your HESI exam by March 31st. We're going to talk in detail about the HESI exam and the chancellor's formula a little later. Those are the criteria for admission to the nursing program. So the testing deadlines are listed there. There's a program information document. If any of you emailed me to say, I'm interested in the nursing program, what do I do to get started? You might have received a document called Getting Started. And on that document, it lists step by step the things that you need to do and in which order they're done. Also on that document is a list of all the prerequisite classes that are required to be admitted to the nursing program, as well as the general education requirements in order to have the degree conferred in registered nursing. Again, the application is there. We also have a college course equivalency spreadsheet. So if you're transferring a course from another college, you can look on this spreadsheet and see if it's going to be accepted. We do have the majority of the colleges listed in our immediate geographic area. It's impossible for us to have every college listed, but we do have the ones that are in our immediate area. The chancellor's formula worksheet is there, the nursing wait list, and then we also have an announcements page that gives updates and information about things concerning the nursing program. Okay. So let's get this started. Let's talk about the big picture for the nursing program. There are some absolute requirements, and I want you to know what those things are so that you can be prepared. So the absolute requirements, the first one being that you have to complete all of your prerequisite classes before you're able to submit an application to our nursing program. And the reason for that is because we use the chancellor's formula, which calculates your overall grade point average, your core science grade point average, and your English composition grade. So it's a formula that uses your GPA. And so if there are classes that are missing that haven't been completed, we would not be able to calculate a correct score for you. Because when we're looking at that score, we're looking at the grade that you received and the number of units for that particular class in order to calculate all of that information. So you must have completed all of the prerequisite classes. If you have transcripts from another school, those transcripts need to be submitted to the Office of Admissions and Records so that they can be documented and put into your student portal, especially if it's coursework that you want to use in application to the nursing program. All of your grades must be sufficient. We accept nothing lower than a C. That includes a C minus. So that a C minus would not be an acceptable grade because that is below a C. So all of your grades must be C and above. You must pass the admission assessment exam, which is the HESI exam. At De Anza, we don't take T scores. That's another admission exam, the TEAS test. But at De Anza, we use the HESI exam. Also, applicants to the nursing program should be prepared to have a social security number in place or an I-10 number. And the I-10 number is the individual taxpayer identification number. We don't ask for that on the application, but we want to make certain that you have those things in place so that when you're ready to sit for the licensure exam, you have that documentation to submit to the California Board of Registered Nurses. Okay, so I'm going to pause for a minute to see if there's any questions. So do we have any questions about?
There's a question about when is the best time to take the HESI test?
The best time to take the HESI exam is upon completion of all your prerequisite classes, because the information from those prerequisite classes is what we're going to test you on. So you need to be able to have that knowledge. Okay. Fernando?
Hi, Mrs. Taylor. You mentioned a score on the HESI exam. Can we know what the minimum score is?
Yes, I have a whole slide.
Oh, sorry about that.
And
Okay.
that's okay. we're going to talk about that in detail because there's a lot to know about that exam. And I have something else to show you with regards to that exam as well.
Thank you, Ms.
So
Deborah,
go,
there's
okay.
another question. Let's see. Can they take the HESI exam on any date, or does it have to be a specific period of time?
Okay, we're going to answer all those questions when we get to that slide. So I wanted to know if you had any questions about the preparation, the things that I just spoke about, completing the prerequisite classes and all of that information. Because we have a whole section on the HESI exam and a separate section on the Chancellor's formula.
I have a
You can
question.
put your questions in chat if you don't want to speak up. I think I heard a voice though.
Yes, I do have a question. So currently retaking A and P. It's just for recency. Does that count towards repeating?
No, we're going to talk about that too. So let me move ahead so that I can answer all your questions. You got really good questions, and those are the things that I'm going to cover. So remember, I just stated that all of the prerequisite classes needed to be completed before you could submit an application. And so let's talk about those classes right now because Val brought up a good point that's extremely important. So there are some prerequisite classes that have a time constraint on them, and that would be your science classes. And so the science courses, anatomy and physiology, microbiology, and nutrition, they have what we refer to as a recency requirement. That means that for De Anza College, you must have taken these science classes within 7 years of your application to the program. So the science classes cannot be more than 7 years old. And the science classes that I'm referring to are the anatomy and physiology, microbiology, and nutrition. If your coursework is more than 7 years old and you're getting ready to apply to the program, then you would need to retake the classes that have so-called expired, and you're retaking them for recency. So it doesn't count as a repetition. You're retaking it because they've expired and you're bringing them up to date. The reason that we have this requirement is because we want your science information to be up to date. The world of healthcare and science changes on a daily basis. To use some examples of having recent science information, say if you took your coursework back in 1983. Some of you might not have even been born then, I don't know. But if you did the anatomy and physiology and the micro back in 1983, since that time, we've been in several pandemics. And you might not have learned about the science of the diseases that were brought about during those pandemics: HIV and AIDS, Ebola, Zika, and COVID. Okay, so in your anatomy, physiology class, and also microbiology and even nutrition, those things are addressed. And we want you to be up to date with that type of science information because when you enter the nursing program, we're not going to reteach any of that anatomy and micro and nutrition. We're going to build on it. So we need you to have established a very firm foundation in the sciences. When I was working in the hospital, every day there was something new to learn. You may learn about a new illness, a new procedure, new medications that had to be given. So in taking on this career, you could label yourself as a lifelong learner. There's always something new to discover in the healthcare arena. So that is the reason for the recency requirement. And at De Anza, our recency requirement is 7 years. Some of the other colleges and universities have a 5-year recency requirement, and some don't have any recency requirement. So if you are applying to more than one program, always know the specific requirements for the particular campus that you're applying to, because this is a very strict requirement and could be the cause of your application being rejected. Okay. So for the other nursing prerequisites, the class that you're in now, Nursing 50, General Psychology, Speech or Oral Communications, English Composition, the math classes, and the sociology or anthropology, those classes don't have a time limit. So when you're enrolling in those, they don't expire. They don't have a recency requirement, only the science classes. Okay, so some important tips. Begin the anatomy and physiology early, because that is taught in 3 different sequences and it takes the longest to complete. So begin that early. Take the other prerequisites around the anatomy and physiology class. So pair those classes with, say, like some of you might be in anatomy and physiology now, and then you've taken nursing 50. Don't overwhelm yourself by overloading your course schedule with a lot of heavy duty classes. All of the science classes come with a lab, and there's other work that has to be done in the lab, separate from the lecture class. There might be some testing in the lab as well as tests that you take in the lecture lab. So you want to pair those things so that you're not overwhelming yourself. The counselor whose name I put up, Tom Wynn, you may want to contact him and ask him to coordinate an education plan for you. And what that means is that Tom will line up the classes or outline them in a way so that you don't overwhelm yourself. So he'll map out quarter to quarter how you should take the classes, depending on whether or not you're working or if you're a full-time student or you have, excuse me, other responsibilities that you have to take care of, and in addition to your studies. Okay, other important tips to know. We want you to not have any repeats of these science classes. When you have repetitions, we have to count those repetitions when we're calculating the Chancellor's formula. The Chancellor's formula is a weighted equation that gives you a score at the end of calculating that equation. The weight, it's heavily weighted in the area of whether or not you repeated the science classes. That is where the majority of the weight is carried. So if we're putting in a number to say that you repeated microbiology 3 times, we have to put the number of times that you repeated in there, and then that decreases your score. So if at all possible, no repetitions of any of the science classes. When you're in class and you feel that you're struggling, get a tutor. You're a registered student at De Anza, and so on the campus we have a facility, the Student Success Center. That's where the tutors are housed. Contact the Student Success Center and get a tutor. They have tutors for anatomy, physiology, micro, and nutrition, in addition to math and all the other subjects. So early on, seek assistance for that. And then if you just feel overwhelmed, like you're not going to overcome it, withdraw from the class before receiving a bad grade, because those withdrawals will count against you. Okay, so I'm going to stop right here. Questions about the prerequisite classes, the recency requirement, or science repetitions?
There is a question about a pass or no pass. Ureli, can you explain what you mean? Ureli Delgado?
I'm going to make an assumption about what she might be inquiring about. Some classes like Nursing 50, you're taking, it's a pass-fail. And so when you pass it, the equivalent of a passing grade when you do pass fail amounts to a C, which is 2 grade points. And so the only class that we recommend, and then you can't really, it's not that we recommend it, that's the way it's set up, that nursing 50 is pass fail. The other coursework, I don't recommend that you take that pass fail, because what if you get an A and you've already elected to take it pass fail? What will be documented on the transcript is a C if you passed, and you could have done A-level coursework, which allows you more grade points, which boosts your GPA. Okay, so the only thing that we want to do pass fail is nursing 50. And that's because of the way that it's set up within our nursing program. All the other classes should not be taken pass fail because remember, we're calculating your overall grade point average, we're calculating your core science GPA, and we want the grade from your English composition class to use in that chancellor's formula. Okay, so hopefully that answered the question.
Thank you, Deborah. So
Okay.
Young, you had your hand up?
Yes, I will finish prerequisite, all prerequisite about at the end of this year.
Mhm.
So I need to new plan for next year. So my question is, can I take it the HESI test on any date I want, or do I have to take it during a specific period?
So again, we're going to talk about that when I do the slide for the HESI exam, but it is distance testing, and you will schedule the date and the time and the location that you want to take the test. But the recommendation is that you complete all of your prerequisite classes first before you take the HESI exam, because we're testing you on your knowledge from the prerequisite classes.
Then you mean I can apply the tests on any date I want?
Yes. And I'm
Okay.
going to get into that in just a few minutes.
Okay, thank you.
All righty. Other questions about the prerequisite classes?
I don't see any more questions on chat.
Okay. Oops. Someone has their hand up. Fernando?
Hi, Miss Taylor. Sorry, I have one more question. So to maximize our formula score, our counselor's formula score, we
Mhm.
overall we just gotta have um try to minimize repeating or not repeating any courses and pretty much having good grades. And if we maintain those two things, we'll be able to keep the formula score high.
Yes.
Okay,
Yes.
just one.
So let's repeat that again. So
Sorry.
to maximize uh, your score, and I'm going to talk about that again, but it is real important. No repetitions of the science classes, because there is a heavily weighted area in that formula. We ask the question, how many times have you repeated any of your science classes? And when we are referring to the science classes, it's strictly the anatomy, physiology, microbiology, and nutrition. Now, I know that you all had to take chemistry in order to enter anatomy, physiology, but we're not counting the chemistry class because that's a prerequisite of the biology department. Chemistry is not a nursing prerequisite, so that class is not included. We're just looking at anatomy, physiology, microbiology, and nutrition. Okay. I don't want to mispronounce it. Sue Wang, did I say it correctly?
Yeah, it's perfect. Thank you, Miss
Oh, wow.
Taylor.
I'm getting
Yeah.
good.
My question is, do we need to take the microbiology before nutrition class?
Yes.
Oh, okay. That's
That's a good question. So here's the order that we would like for you to do this in for the best learning opportunity. So start with the anatomy physiology first because you're studying the structure and the function of the body. You need that understanding before getting into the microbiology class. When you're in microbiology, you're going to study the chain of infection, microorganisms, and disease process. Before doing that, you need to know how the body functions. You need to know about your immune system and what it does, how it works. So anatomy, physiology first, then microbiology, and then nutrition.
Oh, yeah. I'm currently in the biology B, 40B.
Okay.
So in the spring, I'm going to take 40C, and then I would like to know if I can take the microbiology in the summer, or I have to wait until the fall.
Well, I don't have the schedule for summer.
Oh, okay.
So that, if it's offered, if an instructor is teaching it, then by all means sign up for it. But I have no way of knowing that far in advance who's doing what, because every quarter the instructors will submit their schedule to our dean. And some of the instructors are still working in their designated uh, field of industry. So some of your instructors, they may be teaching a certain subject, but they might work in a hospital lab or some other biotech industry. Many of our nursing instructors still work at the hospital in addition to teaching. So their teaching schedule depends on their work schedule.
Got you. Got you.
But
Thank
may
you. I'm
change
going
from
to pick
quarter
that
to
up.
quarter.
Thank you.
Yeah.
All
Deborah, a
right.
couple of questions here.
Okay.
There's a student that took a nutrition class in Gavilan College, and she wants to know if that course counts for application for the De Anza nursing program, or does she need to take the nutrition class in De Anza nursing program?
So here's where that course equivalency spreadsheet comes into play. We do not accept the nutrition credit from Gavilan. And the reason being is that the nutrition class at De Anza and Foothill College is taught in a way that it's geared towards health professions students. And so some of the other nutrition classes don't include the same information in their curriculum. So our nutrition class, we have a lot of pre-med students, nursing students, respiratory therapy from Foothill, radiology students. So we talk about in that nutrition class, the chemistry of food, food as therapy, how nutrition is utilized in a healthcare setting. And so some of the other nutrition classes don't include that. So that's the reason why the credit would not be accepted from Gavilan. And so for that nutrition class, there are on that course equivalency spreadsheet, the schools that we don't accept the credit from, are listed there. So do go to the nursing website and look at that. Again, if you have coursework from another college, the best thing to do right now is to submit an official transcript to De Anza College, Office of Admissions and Records, to have that transcript evaluated. An evaluator in admissions and records is going to look at the transcript to determine whether or not there's course equivalency. And in your student portal where it says degree works, you can go in there and look and see if the credit was granted. Okay. For some classes, you may want to petition for credit. That nutrition class is notorious for not receiving credit from other community colleges. If it's done at a university, sometimes the credit is granted because they will teach the class, especially if that university has a nursing program, they may teach the class in the same format that we do.
One other question, I don't know if you answered this, but if a student gets a C in Bio 40, should they repeat the class for a higher grade or just stay with that C grade?
You're going to have to stay with the C grade because that's a passing grade. And typically they don't allow you to re-enroll. in the same class that you've already passed to get a higher grade. So the thought process going in is that we're going to put our best foot forward. We're going to employ the assistance of a tutor if necessary. We're going to communicate with our instructor for additional assistance so that we get the best grade possible. We don't want to spend money repeating classes for a higher grade. We're going to put our best effort forward the very first time.
One more question, and Karina's planning to transfer to San Jose State nursing program. Does she still need to take the nutrition class at De Anza? On assist.org, it said that she can do either the contemporary nutrition or human nutrition to fulfill the prerequisite.
Okay, that's a good question. I like that question because I think I spoke a little bit about this earlier. If you are shopping for school or nursing programs, that means if you're applying to more than one program, I would go to the source to find out what their specific requirements are. I wouldn't rely on any of these online sites because they could be up to date, they could not be up to date. So just like you have me here at De Anza to talk to you about what the requirements are, I would go directly to San Jose State and say, I'm thinking of applying to your program. I like to speak to your recruiter or the person that reviews the applications so that I make certain that I know what the requirements are for this program. If you're applying to more than one program, I recommend that you do an Excel spreadsheet. And so you want to list the schools that you're applying to, and then you want to list the requirements on that spreadsheet. As you're taking these classes, go through and check off whether or not you're meeting the requirements, and also include on there what the application deadline is, so that you keep up with everything that you need to be aware of. Because in the state of California, there are 77 community colleges with registered nurse programs, and all 77 of us have different entrance requirements. Okay, so that's how chaotic it is. So I always say go directly to the source, block out the chatter of other people telling you, oh, you need to take this, you need to take that. The first thing you want to do is when someone is talking to you and telling you that, ask them, are you a nursing student? Have you gone to nursing school? If the answer is no, you definitely don't want to listen to anything that they're saying, because they don't know really what's required of you or what it's like to do what you're doing. So always go directly to the source.
Yeah. Absolutely. I mean, it would be a shame if you listen to misinformation and all of a sudden when you're ready to apply, you're finding out that you're missing something, a class.
Any other questions?
Hey, no other questions on chat?
Okay. So for De Anza College, we have a full 2-year nursing program, registered nurse program. 2 years is the equivalent of 6 quarters. And so there are 3 different ways to enter the nursing program. You can enter as a regular RN student, or if you're a licensed vocational nurse, we have the LVN to RN transition program. And because an LVN is a nurse, they enter during the second quarter of the program, because in quarter 1, we're teaching basic skills. And so a licensed vocational nurse would not need those basic skills because they're already working in the industry. They've been through a program and are licensed. So they would come in quarter 2 on a space available basis. They would also need to have IV or intravenous certification, meaning that they need to have been certified to be able to start IVs. The third way to enter the program is advanced placement or transfer. Sometimes we have students who have been a part of another nursing program and maybe they had to relocate to the Bay Area from wherever it was they were living, and they want to continue on with their training. And so they will send their transcripts to admissions and records. They still have to meet the requirements of De Anza to enter our program. If, say, for instance, they've done 1 year in a nursing program, when they apply to De Anza, they're going to submit the transcript to show documentation of all of that. We will do a skills test in order to determine their placement within our program. So 3 different entryways into the nursing program. Okay, steps for success. When you're taking your prerequisites, be prepared and serious. And so one of your classmates spoke about making sure that your grades are good in all of your classes, not just the science classes. The higher the GPA, the higher your chancellor's score will be. And the chancellor's formula is one of the admission criteria. So if you have a 3.9, you're going to feel comfortable when you're submitting your application to the program, as opposed to having a 2.0 and some repetitions of science classes. That is kind of shaky. So you want to be prepared and be serious. Drop the biology classes on time if you're experiencing difficulty. When we're calculating the chancellor's formula, we will forgive 1 withdrawal, only 1, and all subsequent withdrawals will be counted. Okay. And so a withdrawal means that you dropped out of the class or you withdrew from the class prior to receiving a grade. Okay. So we will forgive 1 withdrawal, but all subsequent withdrawals will count. And that withdrawal for the chancellor's formula applies to the science classes only. Okay, the other important thing is good English skills are important for all students because we are going to test you on your English grammar, vocabulary, and your reading comprehension when you take the HESI exam. Those are 3 areas of English that we'll test you on. So when you're in the English composition class, that ERIT 1A or ESL class, put your best foot forward, write those essays so that you know how to write and that you're familiar with correct grammar. Again, visit the Student Success Center to obtain assistance from tutors if it's needed. And again, tutoring in any class, the science classes, English, math, any of those classes. Okay. We've talked about this a lot, credit for prior coursework. If you have coursework on another campus that you'd like to use towards your prerequisites or your general education requirements, you must submit an official transcript from that other college, submit that to the Office of Admissions and Records at De Anza, not the nursing program, but the Office of Admissions and Records. They will evaluate the transcript, load the information into your student portal so that you can receive credit for that. Nowadays, we have great technology and the transcript can be electronically transferred. Prior to all this technology, we had to use the snail mail to have the transcript mailed to you, then you'd need to bring it to the college. But you can contact the school, tell them that you'd like to have your transcript electronically transferred to De Anza. There is a fee for that. So make certain that you're getting all your ducks lined up in a row so that we're not wasting money. Along the same lines on this slide, if you're a student that already has a college degree, a bachelor's, or even a master's degree, we want you to do the same thing because we're certain that at that level, the coursework that you completed to get that bachelor's degree, that coursework can be utilized for your general ed requirements. And if that bachelor's degree was in the area of science, perhaps some of the science classes that you took could also be utilized as well. Okay. Now, here's the burning information that you all wanted regarding the chancellor's formula. So the chancellor's formula is a weighted formula that calculates your overall grade point average for the last 7 years. So your overall GPA, it will calculate your core science GPA and also the grade from your English composition class. A passing score for the chancellor's formula is a minimum of 75%. Minimum of 75%. And so again, we're looking at your overall grade point average for the last 7 years. We're going to calculate your core science GPA, and the core science GPA the grades come from anatomy, physiology, all 3 sections, microbiology, and nutrition. The grades from those classes will calculate your core science GPA. And then your English GPA is simply the grade from your ERIT 1A class or the ESL class. Okay. So remember we talked about withdrawals? So in this formula, in addition to calculating these GPAs, the most weight in the formula is carried in the section that asks, have you repeated any of the science classes? We want that answer to be, no, I have not repeated any of the science classes. So in that section, we put a 0. And we hit the button and we get a score. Okay. When we have to start putting numbers into that section, that weight of those numbers are going to decrease the score. Okay. So we'd like for you not to have any repeats. We will forgive one withdrawal, but all subsequent withdrawals will count. And the template for this formula is on the nursing webpage. You can click on the link. Don't print it out, but click on the link and the template will come up and you can play around with it. You can put in your overall grade point average and calculate the other grades, hit the return button, and then you can see what the score is. Okay. This chancellor's formula is one of the admission criteria to the nursing program. So it is important that you have a good score, 75% or greater. Okay, questions about the chancellor's formula?
I don't see anything on chat.
Okay, so we understand.
You got it.
Okay, how that's going to be used and that this is an admission criteria. Okay, the next criteria for admission is the HESI exam. Okay, and so we call this the Nursing Pre-Admission Assessment Exam. It is distance testing. And what that means is that the test is not offered on the campus of De Anza, but you go to a testing center to take the exam. And so at that testing center, there may be other students that are there that are applying to medical school or law school, and they have to take a similar type of exam for the thing that they're doing. On the nursing website, there is a link for the HESI exam. You click on that link, it's going to take you to the web page of the testing center. The name of the testing center is called Prometric. Okay, so when you get to that link, you click on it, you're going to go to the Prometric website. You would put in your demographic information, your name, your address, and zip code. And based on the zip code that you include, they're going to list all the testing centers that are located near you. This testing site, I think, is open 7 days a week. So you choose the date, the time, and the location of where you're going to take the test. So you coordinate all of that. When you're going to take this exam, you're going to test in some very specific areas. You're going to test in English, which is divided into 3 sections. And then you're going to test in math, and you'll test in anatomy and physiology, and also biology. So in each one of these sections that you're testing in, you need to have a score of 75% or greater in each section. Okay, and so the English is divided into 3 different sections: reading comprehension, grammar, vocabulary, and general knowledge. 75% in each one of those 3 areas. Then after that, you're testing in math, 75% in that area. And then you're testing in anatomy and physiology, 75% in that area, 75% or greater, I should say, and also with biology. Now, here's the thing. You have 2 opportunities to take this exam and pass, okay? If you don't pass after the second attempt, then you're not eligible to apply to DeAnza's nursing program, okay? So let's look at something before we start talking about scores. So you notice the areas that you're testing in, these are your prerequisite classes, okay? So when we talk about being in class and being serious and putting your best foot forward, you need to have that knowledge from the class in order to be successful with this exam, okay? So again, you need to score 75% or greater in each section, okay? So if on the first attempt, something happens and you don't score well in one of the sections, on the second attempt, you only need to take the section that you didn't do well in. And we will combine the scores so that everything works out, okay? So say, for instance, you take the exam and you don't score well in biology. On your second attempt, you only need to take the biology section. And we're going to use all the other good scores from those other sections, and then we'll take the score from the second attempt in biology. But on that second attempt, you must pass. If you fail a second time, then you won't be eligible to apply to DeAnza's program. Okay. Now,
Deborah, is there a time frame? So let's say that I didn't pass a second time. Do I have to wait a certain period of time before I can apply again for the DeAnza nursing program? Or is that it? I can't.
now remember, if you don't pass the second time, you can't apply. So the time frame applies to the time between the first attempt and the second attempt. So if you don't pass on the first attempt, you have up to 1 year to take your second test.
Okay, and if I don't pass a second time,
That's it,
ever?
ever.
I see.
Yes. So that's why we want you to make sure that you're prepared when you take the exam. There's a fee for the exam. Current fee is $135. If you have to take it a second time, you have to pay again. So we don't want to spend all of our money on testing. We want to be prepared when we go. So part of that preparation is preparing yourself when you're in class. Are you able to see this book that I'm holding up?
No,
You
no.
can't, no? Okay, let me do something real quick. Let's see. What I was holding up, and if I get my screen together, I'm gonna do something here. Let me put this down and stop sharing is what I want to do. Okay.
Still can't see it if you're holding it up.
There we
Okay,
go.
that's better.
Okay. So This is the latest edition of the HESI Admission Assessment Exam Review. This is a workbook that has a template in it for the test questions. And so it has each one of the subject areas and 2 additional subject areas that we don't test you in. The booklet will also have chemistry and physics. We don't ask you to test in chemistry and physics, but there are specific topics for math, reading comprehension, the vocabulary and grammar, the biology and anatomy and physiology. And then there's a practice test in here to get you prepared to take the exam. Now, you can obtain this booklet via Amazon, or you can order it through Barnes & Noble. Amazon usually is the least expensive, but it's well worth the money that you would spend. I would say once you finish your prerequisite classes, obtain this booklet and practice. Another method of practice for the sciences, if you still have your textbook, review your chapter summaries, and that's helpful as well. If you know that you have difficulty in certain subject areas, then I would say to obtain the assistance of a tutor in the Student Success Center. And then you can tell them, oh, Ms. Taylor asked me to come over here. I'm preparing for the HESI exam and I want to be tutored in grammar. I chose that subject because typically when people are testing and they don't do well, that's the area that they don't do well in. And why is that? It's because we text, we use abbreviations, and we don't write in complete sentences. And so I would recommend that you practice your grammar with a vengeance, because knowing when to use a semicolon, when to put a comma in, how not to have a run-on sentence, those things are very important. And those are some of the things that are listed on that exam. Okay, so questions?
Does it have an answer key to the question?
Yes, the workbook does have an answer key.
Okay. Will there be a predictor test for the HESI exam, or is it just a textbook to prepare us?
Just the workbook, utilizing any notes that you have from your science classes. You're going to have a copy of this slide, and I do have at the bottom of this slide where you can use another practice test online. There is a practice test also in that workbook.
Is the exam limited to 2? Wait, is taking the HESI exam limited to 2 for the HESI in general, or is that just for De Anza program itself?
Other colleges may have different requirements. 2 attempts at De Anza. Again, when you're looking at other schools that may require that you take the HESI exam, you need to ask them specifically what their criteria is. I'll give you an example. Samuel Merritt University has a registered nurse program. It's a BSN program. They utilize the HESI exam. They will test in all these categories that we have listed. And additionally, their exam will also include chemistry and physics, and the minimum score for them is 85%. Okay, very different from what we're asking you to do. So go directly to the source to ask them what their requirement is and the number of times that you can attempt to take it for them. Okay, other questions about the HESI exam?
I don't see anything else on chat. Does anybody have any questions? I don't see any hands up either.
Okay, one other thing that I will mention is that it is a timed test. You will have 4 hours to complete all of these categories. It's electronic, and you can see your progress as you're moving through it. And your scores are available to you the the same day that you complete the exam. When you complete the exam, they'll give you a link to your test, and you can go in and print out your test scores. Okay.
Anything else? What do you take the HESI exam?
Where?
Yes.
Remember, it's distance testing, and there are many different locations for the testing sites, Prometric. So when you're ready to take the HESI exam, you go onto De Anza College Nursing webpage. There's a link for the HESI exam. You click on the link, and it's going to take you to Prometric, which is the testing center. You put in your demographic information, your home address, your zip code. They're going to give you the testing locations near where you live. Okay, so there are many different locations. You go to the one that's closest to you, and then you also will choose the date and the time when you take the exam.
Can they do the HESI online?
When you're at the testing site, the test is electronic.
I think they mean, can they do it at home online?
Okay, can you be proctored at home? In the past, they have done that. I don't recommend that you do that. The requirements are really stringent. You will need to make certain that you have the right type of laptop, that it has a camera. They're going to need to see the entirety of the room that you're in. No one else can be around. If someone walks in on you, or for whatever reason, they think that you have some assistance in the form of a textbook or someone in there giving you the answers, they will shut it down, and that's the end of it.
Yeah.
So I would go to the testing center.
Yeah, I just wanted to share an experience that my daughter had, and this was during the pandemic when she was taking a certification exam online. And as Deborah said, they're very strict. And so when she was 5 questions away from completing her exam, her father popped his head in to ask a question, and right away they shut her down and she flunked the exam. So they're very, very stringent about that. Another question on the same day, do I have to take each section, or can I do one section per day?
No, you'll need to complete the test on the same day that you go.
Any other questions? I don't see anything else on chat, Deborah.
Okay. So once you've completed taking the HESI exam, the next step for you would be to schedule an application review appointment. So what do we do when we are having an application review appointment? At this juncture, we're ready to submit an application to the nursing program. So this is the time when you'll meet with me. You would have done a rough draft of the application. We'll review it together. So I'll answer any questions that you may have about the application. We'll review your HESI scores if you've taken the HESI exam already. And then we'll play around with that chancellor's formula to try to calculate a score so that you know when you leave the appointment pretty much where you stand when you submit the actual application. You'll know when you leave that appointment, yes, I'm probably going to be admitted to this nursing program. Okay. So we have the application review appointment, we complete that, and then in the right time frame, say for instance, like now, some people are scheduling application review appointments with me. After the application review appointment, we go over the application. The application does come with a checklist to remind you of the things that you need to include in that envelope. So you'll need to have the application completed, a copy of your unofficial transcripts, your HESI scores, and 2 self-addressed stamped envelopes. The 2 self-addressed stamped envelopes are extremely important because that's how I'm going to communicate with you. So when I receive the applications, when the deadline date comes, everyone that submitted an application, I use that first envelope to send notification. Your application has been received, it's under review, and by blah, blah date, you'll receive the final determination. Okay, the second envelope is used hopefully to say, congratulations. Enclosed is your waitlist identification number and your position number. So we do have a wait list at De Anza for people entering the nursing program. And so there's no immediate access to the program. You will be added to the wait list and you come in the order that you have applied. So when you receive your waitlist identification number and the position number, that's how you're gonna locate yourself on the list. We don't publish any names or anything like that for privacy reasons. So you're gonna need that number to see your movement on the list. Okay, so that's the next step. After that, while you're on that wait list, there are other things for you to do. If you have not completed all of your general education requirements for the degree, during that time that you're on the wait list, we want you to complete those classes so that when you enter the nursing program, you have no other coursework to take other than your nursing classes. And then when it's time to graduate, you're free and clear to graduate. The degree can be conferred and you sit for the licensure exam. You passed on the first attempt and then you go to work. That's the flow of it. Okay. If you've completed all your general education requirements, there are some other classes that you can take that will benefit you as a nursing student. There's a medical terminology class, an EKG class, and a phlebotomy class, drawing blood. Those 3 classes you can take while you're on the wait list, and that will enhance your nursing skills. If you don't want to take those classes and you're working, then I would say work and save money, because we would like for you not to work while you're in the nursing program. But if you have to, we know that's a fact of life. It's real expensive to live in the Bay Area. But if you're at all able to not work, we would prefer that you do that. When you're working, it impedes the time that you have for studying. And so that's why we would like for you not to work. We can't tell you that you can't work, but we would like for you not to, because it'd be easier on you if you didn't. Okay, any questions?
So Deborah, there was a question, and Anna, correct me if I'm wrong here, but you thought that you had to complete all the prerequisites before applying or taking the HESI exam? Is that what your question is, Anna?
Yes.
So all of your nursing prerequisites must be completed before you submit an application. If you submit an application and one of the prerequisite classes is missing, that will cause your application to be rejected. And so remember, we're calculating your grade point average. And so if there's a prerequisite class that you haven't taken, we can't calculate your GPA correctly because you have no grade listed and no grade points.
The other question is from So Young and De Anza waitlist. Is the De Anza waitlist 100% first come, first serve, or can it change based on other factors like grades, career, volunteer work, that sort of thing?
It doesn't change based on those factors that you mentioned. It may move faster than you think. On Friday, I am going to do orientation with the students who will enter the nursing program in April for the spring quarter. And so some of the students that are entering in spring were further down the list and didn't expect to come into the program until fall or winter quarter. But one of the things that occurs with that list is that people shop for school. So sometimes when I'm calling the 20 from the top, because we take a cohort of 20 students and then we have 10 alternates. And so if I'm calling on the 20 to say, it's your turn to begin, let us know if you're going to join the cohort. Sometimes people will say, I moved out of the area, I'm no longer interested, or I've been accepted to another nursing program. So their name is removed from the list and the other people move up. You are allowed to postpone one time your entrance to the program, and the very next quarter you must show up, or we remove your name from the list. We have had that situation to occur. During winter quarter, there were 2 people who were eligible. I sent the email and they didn't respond. I called them on the phone several times and left voicemail messages, and they didn't respond. So as opposed to kicking them off, because it would have been their first time being invited, you never know what's going on in someone's life. So I used their deferral and thought, whatever is happening, maybe they'll come in the springtime. And so springtime is here. I sent the invitation and I didn't hear from one of them again. So that person's name was removed and someone else was invited in that person's place. So sometimes it may move faster than you expect it to. In this instance, there were also some people who have been accepted into other programs. So that's freed up a lot of spots. I then call on those 10 alternates to say, hey, would you like to begin in the springtime? Because technically they weren't due to start until fall, which would be September. And so some people said yes, and some people said no. And so I still had some spots available. So I went past those 10 further down the list to call until we had a cohort of 20. So some people who might not have come in until winter of 2026 are starting in the springtime.
So Deborah, based on all those factors that you had just said, what do you think the average wait time is from the time you're put on the wait list till being accepted into the nursing program?
I would say the average length of time is 9 months, which equivalent to one school term. If we say September to June, that's 9 months. The same length of time as the women carry a baby.
Yeah, I know. That's what I was thinking too, right?
Yeah. So we know how quickly that goes by. So that's why I said, if you're working and you don't want to take any of those other classes and you have all those other things in order, work and save as much money as possible so that when the time comes, if you're working in a hospital setting or if you're on another type of job where you have the ability to work per diem or on call, you could do that on the weekends. I don't recommend taking a PM shift because your clinical day is going to begin at 6 in the morning.
Yeah.
You'll end about 2:30, and then there's always a debriefing at the end of the clinical day. So if you're going to another job after that, chances are you probably won't be off until 10 or 11 o'clock.
Yeah.
When you come home, you're tired. You've worked kind of 2 jobs because you've been to nurses training and then you were on a job. You get home, you're going to take a shower and go to bed.
Yeah.
When would you have had time to study?
Deborah, if you can speak on 2 things. First of all, and you said if students are already working in a hospital or let's say they're a certified medical assistant, does that help with their application process being accepted sooner?
No, unfortunately, we don't give points for why can't I get my words together?
CMA being CMA or EMT?
Yeah, we don't give points for healthcare experience. There is another campus that does. Ohlone College has a registered nurse program. They're located in the city of Fremont. And I think the total points for the application is 100 points if you have healthcare experience or you volunteered in a healthcare facility, you get 30 extra points on your application, but we don't do that. It's strictly the criteria of your score from the chancellor's formula and the HESI exam. So if you perform for us on paper, then you know that you're being admitted.
The other thing I need you to, if you can speak about, is also you said that there are shifts that you would have to take during the nursing program, one of them being PM shift and of course day shift. Can you speak about attendance and punctuality?
Oh, yes. Very important, especially on those clinical days. On the clinical day, you're going to be on the floor with the nurses who are employed at the hospital. Their shift begins at 6 a.m. You must be ready because your instructor is going to assign a patient to you. You're going to go and to the room, the conference room, and get report, just like the people who work there. So you can't arrive at 6 o'clock. You actually should be in there at 5:30 so that you get all the information that you need, gather yourself, and know where your patients are. And then you take report and begin your day. Punctuality, extremely important. Most of the clinical training occurs during the day shift. There may be one quarter where you'll do a PM shift because one of our nurses is a midwife. And you might do a PM shift with her, depending on what her schedule is. I don't know how long she's going to be with us because she's been using that R word, retirement.
Oh my
So
gosh.
yeah, so I don't know. I understand, that she's put her time in, but I love her being here because the students get a really good experience. She is a nurse midwife. She delivers babies under the direction of a physician, and it's a great experience when our students show
I
up
took
to
my
work with her.
I took my DNP program with her,
Did
Deborah.
you?
Yeah,
Okay.
we were in
Yeah.
the same cohort.
So we're speaking, the instructor's name is Olga. And
Yeah.
so my favorite thing to brag about, and I know she probably gets tired of me, but for me, I think I was my grandmother's favorite granddaughter. So that's why it's important to me. But Olga delivered her granddaughter, her daughter
Oh,
child. And so Olga's name is on her granddaughter's birth certificate. Now,
oh,
how awesome is that? That you have that historical documentation that your grandmom
wow.
delivered you. So that every time I say that, that excites me. And she's like, it ain't that big of a deal. And I'm like, yes, it is.
She's
So see,
great.
and another example of what the nursing profession can bring to you to be able to help your own grandchild enter the world. That's pretty awesome.
And she really
That
is a nurse advocate. She is so passionate about what she does. Um, she's just truly wonderful. Olga's wonderful.
yeah.
Anyway, any other questions for Deborah?
Okay, well, that if there are no, oh, there we go, Alondra.
I just wanted to know what your graduation rate for your program was.
Oh, thank you for asking that. I am proud to say that our pass-fail rate, and you said graduation rate, but I'm going to brag on something else, because I'm about to say it's more important than the graduation rate, but it coincides with the graduation rate. So, when our students graduate, the next step for them is to take the licensure exam, the NCLEX exam. And so for the past 3 quarters, our students have had a 100% pass rate. And why I had to pace myself, why I'm getting so excited about that is that they passed their licensure exam on the first attempt, the first time that they took it. Prior to these last 4 quarters of having 100%, we were steady at 96%, but we were able to boost that. And so that's really important. When you are looking at a nursing program, you can gauge how prepared the nursing students are by their pass-fail rate. So when you're looking at schools, you can go on to the California Board of Registered Nurses website, and there is a page that has all the accredited nursing programs listed. And for each one of those schools, the Board of Registered Nurses lists their pass-fail rate. Look at those rates, and that should be a deciding factor in your selection of which school you would like to attend, not the hype about the school or the name, because the school could be a very prestigious and well-known place for other reasons. But if their nurses are having a 77% pass rate, that's not a good thing. And you don't want to go to that program because only 77% of them are passing on the first attempt. Why is that? If that were the situation, I can use an example of in the city of Oakland, there used to be a 4-year college, which is now closed. Holy Names University was a 4-year institution, and they had a bachelor's degree program for nursing. And a mile away from them was a community college, Merritt College. And they had a registered nurse program. Well, at Holy Names, the pass-fail rate for the licensure exam was 77%. And at the community college, they have been consistent with 100% for the last 3 years. So if you're paying $4,000 a semester for tuition and the pass rate is only 77%, your money's not being put to good use. You could go to the community college where you're paying a lot less, but the training apparently is better because for 3 years in a row, 100% pass rate. So those are the things that should be important to you, not that it's UC Irvine or that it's UCSF or whatever, unless that pass rate is up there at the tip top.
Yeah, and I also want to say that there's a lot of these private type of universities that pop up. They're not the UCs or anything like that, but and a lot of them, their main goal is really to get as many students as they can because they say, oh, we'll get you through these nursing programs in X amount of time. And what they're looking for is just a lot of revenue, a lot of students, so that way they can get a lot of money. So be careful if you decide to go to one of these uh, private type of universities. And I can't think of a name right now, but
Unitech.
yeah, Unitech, because you want to check their credibility. You
Right.
really want to do that research.
Do ask questions. I want to piggyback on that. Sylvanita, I'm glad you brought that up. I just had a knockdown, drag out fight with one of my relatives because she wants to attend nursing school and she works and she wants to attend this program called Nightingale.
Oh,
And so I hadn't really heard of it. So I'm researching with her. And so one of the red flags for me was that she could do this online. And I'm like, how are you going to do your clinical training online? Well, the
yeah.
clinical training wasn't going to be online, but all of the things leading up to the clinical program are online. The skills you practice on your own, not in front of your instructor in a skills lab. And then if she were to go to this place, she lives in California, but she would have to go to either Arizona or Nevada, some other state to do the clinical training. So that's an expense. You're getting on a plane, you got to have a hotel room, and you're going to another state to do your clinicals. I don't understand the reasoning for that. And my concern is, why is that? And then if you're doing your clinical training in another state, are you going to be eligible to sit for the licensure exam? And so my relative brought up the name of this school. And this afternoon, I have an appointment with someone who is a De Anza student who is also looking at this place. I don't know where they're advertising, but this is a new name that I've heard popping up. Be very careful. Do your due diligence. Ask a lot of questions. Make them put it in writing, because that is a big concern. If you're doing, why can't, and then if the school is in California, why is it that you can't do your clinical training in the same state where you're studying? Big red flags. So be very careful, because once you get into these programs, if they're a private school, they're extremely expensive, $90,000 to be in the program. And then they, of course, have their own rules and stipulations. Unitech had been under fire because of an attendance policy that they have, that you could only be absent for 5 days. And we don't recommend you being absent, but in the reality of life, you could get the flu and be down for 5 days. And with that, they could kick you out of the program and you still owe the money, but you're not getting the education. So read the fine print. Don't be in a hurry, because sometimes that's the way they advertise and get you, is that they can move you faster as opposed to a community college or university. And when they're private, if they're not accredited in the same manner as a college, if you go to that program and you finish the program and then you want to continue to pursue your education and get some higher level degrees, the coursework may not transfer, and you may be starting over from scratch. So do be careful.
The other thing also is that, again, when you go to apply for your first job, then if it's a college that, let's say, a hospital may not be familiar with, they may ask you questions about it too. So there's a couple of questions on chat, and then there's a couple hands that are up, but let me ask this question. Patricia said that her employer offers Nightingale College, and are they contracted with De Anza for clinical? And then there's another question about the credibility of Evergreen College program.
Okay, if you have the choice, I would choose Evergreen every day, all day versus Nightingale, if your employer has some type of agreement with them. Evergreen Valley is a community college. I was just there about 3 weeks ago. It's a beautiful campus. I toured the nursing program. There's state-of-the-art equipment over there, simulation lab, separate skills lab. I would do that as opposed to going to Nightingale, if you have a choice. And no, Nightingale does not. If you heard the comments that I just made, you know that Nightingale does not have a contract to do clinical training with De Anza. Based on what I learned with my relative, you're going to have to go out of state to do your clinical training. I don't know why they don't have hospitals in the area where they're advertising. I don't understand that, but it's interesting. I would schedule an appointment with me so we could talk about that. And I want to know who your employer is and how they're partnering with that school. But Evergreen, if you're not going to come to De Anza, I would say go to Evergreen.
Yep. Yep. And there's a couple hands, Alondra and then Fernando. Alondra?
Yeah, I was just wondering, have you ever run across the issue when people are doing clinicals, you don't have enough placements for students?
No, we always try to make certain that that is taken care of because we are required to do certain things with you by the Board of Registered Nurses. We every 6 years have an accreditation process with them, and that's one of the things that we must have in place for you. We work hard to make certain that those types of things are in order. Our students go to El Camino, Good Sam, Valley Regional, O'Connor, and I'm probably forgetting something. I'm probably
Kaiser.
forgetting one of the hospitals.
Do they go to Kaiser?
We are talking to them currently to
Mm,
negotiate being able to go to the Kaiser in Santa Clara.
okay.
So, Alondra, did I answer your question?
Yes, thank you.
All righty.
And Fernando?
Hi, Professor. Hi, Mrs. Taylor. I had another another question. It was regarding the you mentioned earlier that Ohlone had some points if you had prior experience in
Mhm.
the medical field. Is there any points that De Anza like takes for anything or does it no nothing? Yeah, okay, I just wanted to ask.
No, it's strictly the scores from
Oh,
the chancellor's formula and the HESI exam. We wanted to, not to say that it's an, I'll go ahead and say what I was going to say. We want it to be an even playing field for everyone who applies. So you know what the criteria is for you to be admitted. You know how you have to perform, and everyone is judged on the same criteria.
okay. Okay. Thank you.
Let's see. One other question. For the chancellor score, if you retake an English class from a different community college, how does it calculate with your English GPA? Or does she need to retake it for a better GPA? She wants to retake it for a better GPA.
Okay. I hear you saying that, and I think this is a pet peeve of mine as a former high school educator, um, a mom, and all the other hats that I wear. When we're in that class, we're going to put our best foot forward so that we aren't spending money unnecessarily repeating classes. If you put your best foot forward, get a tutor, you're going to get a good grade. Okay. Every time you repeat a class, you're paying for that class. You will need that money for nursing school. So if you have a passing grade, I would not repeat that class. I would do something else to boost my GPA if that's the situation that you're in. And those are some of the things that Tom and I talk to you about when you make appointments with us. But if you're getting started and you're entering class, let's not have that mindset of if I don't do well, I can repeat it. We want to do well the first time because school is expensive. We don't want to keep spending our money retaking classes. Okay. I don't recommend doing that. If you have to do it because say sometimes people, when we calculate the chancellor's formula, they don't get a good score. In that instance, if all of your other grades are passing grades, then we ask you to take something different and to make certain that you get an A in order to increase the grade points and increase your GPA. That's the strategy that we would take. But think about what you're doing, because if you're retaking classes that you've already taken, you're spending money on something that you already accomplished. So we want to be wise with the decisions that we're making.
And I want to be cognizant of the time here. We have 5 minutes left, so there's one more question. And I'm not sure what you're referring to here. Can you explain your question? Anna Aho?
Yeah, sorry. We were talking, I think it was said that people were going to hospitals to meet up with nurses and follow up for clinical days, or is that in a classroom in the school?
So when you're in the nursing program, 3 days a week, it's class and the skills laboratory where you practice your skills prior to going to clinical to perform them on a patient. So 3 days on campus, 2 days at the clinical site. And when I refer to the clinical site, I'm referring to the hospitals that you're going to go to practice your craft.
Right. And does the school offer any like commuting ability to that, to the hospitals?
No, you're responsible for getting yourself there.
Okay.
Thank you. So how much does Deanne's nursing program cost, Deborah?
As
There's
of this year, with inflation and all that stuff, for the entire 2 years, it's a little over $8,000. That includes your tuition, the books and study supplies, uniforms, and things of that nature. So a little over $8,000. It used to be $5,500, but things go up. And so that's where we are right now. Still less than the university and some of these private institutions. And that's $8,000 for the entire 2 years.
And you can make that up once you get your license and you start working. You can make it up 100 times over. Okay. Thank you, Alfred, for putting that. Once we're in a cohort, if folks are in the same area, I bet we can carpool. Absolutely.
Oh, yes.
Absolutely. Love it, Alfred. I love that. Okay, so we're at time. One last question for Deborah. Specific uniforms.
Yes.
Okay, no, you can't use your own scrubs. You have to be identified with Deanne's nursing program.
That is correct.
Is it paid up front, the $8,000?
No, that is paid as you go along. Once you enter the program, you'll probably spend maybe $2,000 to $3,000 at the very beginning to get all of the uniforms and supplies in your books. But those books and some of the testing materials will carry you throughout the program.
Okay. Deborah, again, I wanted to take this opportunity to thank you. You know how I dearly love to have you talk to the class. And I love the fact that we are joined at the hip to make sure that the students get through the nursing program and get their applications moving. But again, thank you so very much. And I will see you at 3 o'clock, right?
All righty.
If you guys have any other questions for Deborah, you have her email address, so please do not hesitate to contact her. She's fabulous.
All righty. Bye-bye.
Thanks,
Thank you so much,
Deborah.
everyone.
Bye.
Okay, so I do not have to ask you for an attendance question. I have taken roll while Deborah was speaking, so you are free to go and enjoy the rest of your week. Thank you, everyone, and have a great day. Thank you.
Thank you.
Thank you so much.